Problems of correcting SCID using stem cells. Hematopoietic stem cells are the stem cells that found in the bone marrow and have lifelong self-renewal and differentiation. They are able to develop into different types of blood cells. Hematopoietic stem cells transplantation is the process of taking HSCs from one person and re-establish them into another person whose bone marrow is damaged. HSCT is an effective approach for SCID treatment. The first problem is the recipient has enough cellular immunity to recognize the transplanted stem cells as foreign because our immune system is programmed to respond against foreign materials and attack them. So the patient will have the immune function to reject the allogenic grafts. Another situation is failure of engraftment, means when recipient's bone marrow is full of defective stem cells and the HSC cannot find any place to establish themselves. Second problem is risk of graft versus host disease. Mature T cells from donor that develop after transplant perceive the host tissues as foreign and attack them. So the problem here is the lack of suitable donor for the patient and must identify a matched donor. A matched donor is whose HLA same with those of the recipients. The compatibility of HLA is vital to determine the chance of engraftment. At the same time, keep the risk of GVHD low. However, if a perfect match cannot be identified, can use haploidentical donor. That is a good question. The problem is mature T cells in bone marrow of haploidentical parent would able to recognize HLA alleles unique to the patient and cause GVHD. First limitation caused by HLA mismatched donors is immunological complications such as GVHD due to HLA differences between donor and recipient. Secondly, decline in T cell function because no donor stem cell engraftment. Thirdly is slow immune reconstitution. Antibody production after HSCT for SCID depends on specific form of SCID. Fourthly is health of patient, which is good health and free from infection, so that will be high survival.